Hello and namaste. Welcome to all our viewers joining this Facebook Live session and wishing you all a very, very happy Women's Day on behalf of Apollo Hospitals. This is Dr. Srinidhi Chidambaram. Today, we are having a series of Facebook Live sessions on various aspects of women's health, and I do hope that you will join all of them and get your top queries answered by our leading medical experts. Bone health. Now, this is very important at every age and stage of life for women. The skeleton is our body's storage bank for calcium, and that's a mineral that is also very necessary for our bodies to function. Loss of bone strength can lead to what we call osteoporosis, a disorder in which the bones become very fragile and are more likely to break. And older adults, especially women with osteoporosis, are very vulnerable to fractures, which can seriously limit your mobility and quality of life and independence. Fortunately, there's lots that we can do and lots to learn at every age in order to keep our bones strong and healthy. And in fact, the reason why we are discussing bone health today particularly is because it can affect anyone, but women are more likely to get affected by osteoporosis and develop weaker bones than men, and especially towards menopause when there is a sudden drop in estrogen, which is the hormone that is important for bone health, and this loss of estrogen can lead to rapid bone loss. So it's very important that we pay attention and discuss power for your bones, what you need to do to preserve bone health throughout your life, starting quite early on in life. So to discuss this with us, I'm very honored and delighted to welcome Dr. J Reddy, Chief Joint Replacement Surgeon, Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. J Reddy completed his MBBS from the Osmania Medical College, Hyderabad. He did his MS at PGI Chandigarh, DNB from New Delhi, and then did a string of FRCS degrees like from England, FRCS Edinburgh, Glasgow, and then his FRCS in Orthopaedics as well from the UK, and a fellowship in advanced joint replacement surgery from both UK and Germany. His specialization and special interests include a variety of orthopedic conditions like joint replacement surgery, complex primary revisions of the hip and knee, sports medicine, arthroscopies, and he has organized numerous conferences, given lectures, performed live surgeries. His list of awards are numerous. To mention a few, he was the best outgoing student from the Osmania Medical College, won the Michael Bestow Audit Prize in 1993 from the Queen Elizabeth Hospital, Kings Lynn, UK, won several awards like the Best Orthopedic Surgeon of 2018 by HI9, Best Orthopedic Surgeon of 2019 by the Times of India, the FAMA Asia GCC Award for Excellence in Leadership, has held various positions as well, Consultant and Head Lower Limb Unit at Basildon and Thurrock NHS Hospitals, UK, spent over 14 years in the United Kingdom, was a coordinator of the MCH Orthopaedics course in the UK, board member of our FNB from 2018, the Arthroplastic Society in Asia, and the list just goes on and on. And he's also had many publications and research journals to his credit. Welcome, Dr. Reddy, to our special FB Live session for Women's Day. And I look forward to hearing from you about how we can increase the power of our bones.
Namaste. Thank you very much for your kind words. As you rightly said, I think osteoporosis is one of the leading cause for disability. And this is a condition where difficult to diagnose, as there is no single test to diagnose. And there are many undiagnosed, undertreated patients. They directly present to us with complications, especially with the fractures. So it is important to prevent it, to diagnose early, and treat before they end up with any complications. So on this special day, I think we should take this problem forward and make all possible solutions.
Absolutely. So, Doctor, we'll begin by discussing why does bone health matter in the sense that why should we preserve it and why should we nurture it from an early age?
Yeah, that's a very good question and important question, because bone health is not only related to the bone. If bones are strong, muscles will be strong. Muscles are strong, joints will be strong. So overall body depends on bones, muscles, and joints. These are all interlinked. And if we can make bones strong, so the entire body will be healthy and they can do good physical activity, and the rest of the problems, especially the diabetes and hypertension, can be prevented by keeping our bones strong.
Absolutely. So, why does it? I mean, in the sense that like what is the gender difference between men and women, and what happens in women that so many more of them develop bone losses and osteoporosis so quickly?
Yeah. What happens is men generally, by their hormonal status, the bones are strong, muscles are strong to some extent. And women, because of their hormones, to some extent, the bones and muscles little weak. And as they age, because of the hormonal change, women are more affected and they end up with osteopenia and osteoporosis. So if they understand this, they can prevent it.
So you were saying that it is difficult to diagnose osteoporosis, but what are the general mechanisms by which we can assess an individual and say whether their bones are healthy or not?
Yes. As I said earlier, osteoporosis is a very difficult problem to diagnose as there's no single test. Most of the time, it's a history. If anybody in the family has osteoporosis, especially osteoporotic fractures, and they were treated for osteoporosis, and an examination, maybe generally they complain of bone pain, or especially reduction in the stature, especially the spine going forward, curvature getting worse, and history of fracture in the past with a trivial injury. These are the indications. And also we can do, most of the time, test bone density test, BMD, of the hip as well as spine, but they are not very accurate as we want.
So does that mean that they may underdiagnose the problem or overdiagnose it?
Yes, very much, very much.
But they still will provide some kind of idea.
That's the only tool we have. So we have to use it.
We have to use it, yes. So how does this, like on a physiological level, how does this bone loss happen? What do we really mean by bone loss? And how does it really, like what factors accelerate it or reduce it? Could you just give us some?
Sure. I think it's very important. That's an important question. Very important to people to know what happens to the bone. Bone doesn't stay like that forever. There is a constant formation of the bone, resorption of the bone, absorption of the bone. What happens during childhood? There is more bone formation, less absorption. So more and more bone will become stronger. And as they become adolescent, as they become adult, this balance is maintained. So like it's a hair fall, like skin falling every day, and reformation. So what happens? It's a constant mechanism where bone is getting deposited and is getting absorbed. And over a period of time, especially in ladies, what happens at the age of post-menopause, there is more absorption than deposition of the bone. And people who have medical problems, who are sedentary, who do not do proper exercise or proper preventive measures to prevent osteoporosis, the bone loss is more and is more common as we get older.
So for women, there is a during the time of menopause is when it all really happens, or the bone loss happens throughout life?
Yeah, bone loss happens throughout the life, but at a younger age, people who are active, who are maintaining good health, the bone formation is more than the bone loss. Okay. But in postmenopausal, people on steroids, people with the diabetes, smoking, and on other medical problems, the bone loss is more than formation of the bone. And most important factors are vitamin D and calcium intake, which will maintain a balance of the bone formation as well as resorption.
So, what are the main things that a woman can do, and when should she start thinking about bone health? Because many times what we see is that already the osteoporosis has set in and there are fractures, and that is when then even the oral medication may not even help, and
Sure.
it all become too late. So, when should we really start, and what should we do? What are the preventable mechanisms? Some
Yeah.
of it, of course, is not in our control, but what can we do to make the best of it?
Yeah, I think that's an important factor, because what happens is as we grow older, in the sense adolescent and adults, most of the time, without our knowledge, there is some level of physical activity which will keep bones healthy as well as muscles. And when we get older, maybe 40, at the age of 35 to 40, we have to be careful, especially women, we should take extra measures to prevent extra bone loss. So the balance is maintained, same amount of bone is formed and absorbed. And the best medicine for this osteoporosis is exercise. We keep saying in meetings that number one medicine is exercise, number two medicine is exercise, number three medicine is exercise. There's nothing to replace exercise. And we will talk about what kind of exercise as we move on.
That's what I was just going to ask you. Yes. Because so apart from the exercise, is there something that because there is always this confusion whether to just start popping calcium tablets or take vitamin D supplements. So is that kind of mandatory for all middle-aged women, or does it depend on anything?
It is. I think calcium supplements are important, provided you take enough milk, coffee, tea, or in yogurt we take. There is enough calcium in that. What happens is taking just tablets doesn't get absorbed to the body unless it's balanced. There should be a mechanism where there is a demand from the body, and it will also help vitamin D. So if body wants more calcium, I think normal diet will have enough calcium unless there is more demand in such special situation. So we have to create in the body to take more calcium by doing various things.
So what are some of the common food items that you must include in your diet apart from the dairy and curd? Is there, what
Yes.
are the different
I think bone contains not only calcium, it contains minerals, as you said in the beginning. It contains proteins, high quality protein. So it's important to have vitamins, minerals, and good quality protein. So fresh fruits, fresh vegetables, and high quality protein. High quality protein can be peanuts, simple, or almonds, dry fruits, most of the dry nuts and fruits. Generally, we recommend about maybe 15 to 20 of these almonds, maybe cashew nuts, one of these dry fruits you can take every day. That will keep your requirement, high quality protein requirement, which is essential for the bone, along with vitamins, calcium. I think if you take enough yogurt and these things, not required. But if you're not sure, you can take one calcium tablets, because there is no toxicity, because body will get absorbed the only required amount. And the most important factor is most of us are deficient in vitamin D. And vitamin D is very, very important for calcium absorption and bone health. And as we know, vitamin D, we don't call it a vitamin D. It's like a hormone. It has multifactorial function. So it's very, very important, because we're not exposed to sun. And the sun exposure is between 10 to 3 a.m., which is 10 to 3 p.m., which has got required ultraviolet rays, which may be not practical. Yeah. So I think I would advise everyone to take vitamin D once in a week or once in 2 weeks, depending upon their requirement, so that taking orally, it doesn't cause any vitamin D toxicity.
We were also talking about the exercises that
Yeah.
need to be done. So here again, a lot of people just do a lot of cardio activities, and because at that age, it's also about the weight loss.
Yeah.
So there is some confusion about, like what kind of, because I know this whole thing about the weight training and strength training. There are two schools of thought about it. Like some people say that no, that will add your weight, and like better to just do more of cardio. So what is your advice in terms of
Yeah.
bone health, on what kind of exercises one should?
Yes. I think it's bone will respond to the load. It's a low load, repeated load. Routine walking and cardio probably will not have that much impact
Yeah.
on the bone, because bone needs demand. Demand means weight bearing exercises. It doesn't mean lifting heavy weights. Small amounts of weight, probably half kg, and repetitive. It has to be probably every day, maybe 20-30 minutes, 5 days in a week. So weight bearing exercises are very important for the upper body, lower body. For example, you can do a rowing machine on a low resistance, probably 20 minutes. That will put entire body under load, and it's very good for bone. As well as swimming. Swimming also puts entire body exercises, or gentle exercises. I mean, half kg dumbbells in each hand, you take few times, or maybe 10-20 minutes every day. That will help. What happens, it will help not only the bone, it will help muscle become stronger, because muscle health is directly related to the bone health. If
Yeah.
muscles become strong, bones automatically become strong. Muscle put a lot of load on the bone, and bones become healthy, and joints also become healthy. I think one factor what I want to say everyone is, when we are walking, it's not only the body weight that passes through the knee joints, it's about 8 times of the body weight. When you're going up and down stairs, 15 times of body weight passes through the knee joints. When you sit on the floor and get up, it's about 15 to 18 times. So what happens is, if muscles are strong, bones are strong, 50% of the weight should be taken through the muscles, and 50% will go through the joints. That way, what happens? The joints are protected by keeping strong bones and muscles.
Absolutely. uh, so what about like different phases, like in a woman's life there are certain, it doesn't go like the hormones keep going up and
Yeah.
down. So there is first the puberty, and then there is the pregnancy and breastfeeding, and then there's also the perimenopause, and then the menopause. So in all these stages, what are there any different things that women should do, or all these lifestyle changes, should they start? I mean, I guess you need to start early, not late. But what are the special situations in these phases? What
Sure,
happens
sure.
to the women's?
There is a more demand during puberty, because there is sudden growth spurt. Normal diet won't be enough. So they need supplementation of calcium, good protein, vitamins, as well as vitamin D, because sudden spurt should be supported by healthy diet. And as you said, during pregnancy and lactation, because they're feeding two people and supporting two people, so there is a requirement of supplementation. They should take calcium tablets, they should take vitamin D during lactation and pregnancy, along with healthy diet. That will help them prevent deficiency of calcium, vitamin D, and prevent osteopenia and osteoporosis later in life.
So what is the progression towards osteoporosis? So when is it osteopenia, and what is the difference between
So
osteopenia and osteoporosis?
by the time it comes to osteoporosis, it's too late. And osteopenia also probably a bit too late. So what happens is, in the beginning, early stages, very difficult to diagnose. So we should assume everybody that as we aging, bones going to be aged. So we have to take preventive measures without any, I mean, diagnosis without any requirement. But osteopenia means the loss of bone from the skeleton is certain extent. Still, it is within physiological range, but doesn't lead to fractures. For example, you take a pipe, the thickness of the wall of the pipe is reduced. If it about 30% reduction is osteopenia. If it is more than 50% is osteoporosis. And the bone becomes fragile and it breaks, especially the spinal column, hip bones and wrist bones. They become very fragile. With a trivial injury, they become broken and end up with the fractures. So that is a stage. That's too late, but before they start that stage, any bony pain, any weakness, inability to walk prolonged period, inability to climb stairs, if everything is okay, then inability to get up from floor. Those are the indications, indirect indications that there is something wrong with their bones and muscles.
So now I think we will take some questions because they're coming on the live feed. So I'm just looking at them now. But before that, I think a little more, could you tell us about this bone density test? And is it necessary that everybody has to go through that? And at what age should they do that?
Yes, it is very essential. As I said, it's very difficult to diagnose. So this only tool we have. So bone BMD of the hip as well as pelvis is very essential. We have to do, I think, all women probably around perimenopausal age, they should have it maybe once in a year, along with their medical health, because everybody should have their health checkup once in a year. After the age of, nowadays we are bringing the age down to 30, but about 35 onwards, they should have a BMD along with other bone related tests.
Sure. So we'll now go to some of the questions that are coming on our live feed.
Sure.
They may not all be related to osteoporosis. Some of them are general. So the first question is, what is the carpal tunnel and what can cause the carpal tunnel syndrome?
Yes. Carpal tunnel is a little nerve in the hands gets trapped, the median nerve. And there's so many reasons. Most of the time, 50% of the time, it's idiopathic. We don't know the cause. The nerve is protected by a tunnel. The tunnel becomes tight and they feel pain in the thumb, index and middle finger, especially nighttime. They wake up with a pain, with a tingling numbness. And it's very simple problem. Most of the time, with simple physiotherapy exercises, it will get better. And this is common during pregnancy. Common people on medication, especially on diabetes, hypertension, common in thyroid, hypothyroid people, where the tissues gets deposited there. And more in its beginning, they need only physiotherapy, little exercises, medication. And if it doesn't respond, probably we have to do injection. And some of maybe 10% of them need surgical release. It's about, we do under local anesthesia, takes about 5 minutes to release the nerve. So basically it's a nerve compression in the palm.
Okay, this one we've already discussed, but basically this question is about how much of calcium and vitamin D do I need every day so that I can get enough of these nutrients?
Sure, I think we have to, because that's important, we can repeat. Vitamin D 60,000 units weekly. Once you can take initially probably about 6 weeks to 3 months. Later you can increase once in 2 weeks. Later once in a month, because most of us are not exposed to enough sunlight. You can take it forever. Once in a month or once in 2 weeks, no harm is done, because vitamin D toxicity doesn't happen if you take by mouth. Toxicity happens if you take by injections. So I won't advise injections for these people, tablet. And people above age of 30, pregnancy, puberty, lactation, or 30-35, they can take calcium tablets, probably 1 gram calcium every day they can take it.
So, doctor, this is my question really. So there are some calcium combinations which come with the vitamin D, like a daily dose.
Yeah.
Do you think that is still okay, or should calcium be
what
taken
happens is that's, I think, there's again dilemma. The combination of medicines sometimes doesn't give absorption. Vitamin D biggest problem is it has to be taken empty stomach. Absorption is a big problem. So I won't advise combination. It's better to take individual medicines.
Individual medicines. Okay. What are the signs of a rotator cuff injury? Are strains and sprains to my shoulder dangerous?
Yes, yeah. Rotator cuff injury is very common, especially women at the age of about 45 to 55. What happened? The main tendon, which is responsible for lifting up shoulder, most of the activities, gets damaged by wear and tear or previous injury. And what happened? They complain of pain, difficulty in lifting, especially reaching top shelves and lifting some weights. So if they have limitation of movements with the previous history of injury, especially this is common in diabetics as well, because the rotator cuff problem is more common in diabetics. Most of the time it's diagnosed with MRI scan. X-ray doesn't show anything. On a clinical examination, we're suspicious. You can say doctor to get an MRI scan. And most of the time, we should be able to repair and do whatever required for this rotator cuff damage.
This is another thing which we already discussed, but this is again about how much exercise do I need to boost bone strength and which exercises you recommend.
Yes, I think there is no upper limit, to be honest, as exercise. As long as your heart is normal, before you go to any exercise, you must consult your cardiologist, that irrespective of age, because nowadays we hear people in the age of 30 getting sudden cardiac arrest. So you must get health checkup, especially the cardiac health. And there is no upper limit. As far as bone health is concerned, is a load-bearing exercises, like lifting small amount of weights repeatedly, 5 days in a week, about 20 to 30 minutes, along with other combination of exercises. And like a rowing machine, cross trainer with not much of resistance. But I won't advise lifting heavy weights. What happens is lifting heavy weights will rupture muscles, small amount of muscle fibers. That will lead to scar tissue, and that is a bad thing for your muscles if you're not a professional weightlifter. So don't attempt to lifting of heavy weights. Recently, there was a publication about meditation. If you do meditation, bone health improves indirectly, in the sense the bad hormones which are responsible, like steroid hormones in the body, will be less. People who meditate regularly, which are responsible for bone absorption, and they release good hormones which are responsible for bone formation. So that also you can take up, because meditation is good for in majority of the conditions.
My aunt has a lot of pain in both knees.
Yeah.
Can it be osteoarthritis? She had a ligament injury also in the past.
Yes. If she's, I think she didn't say about the age, but if she's about 45, 50, more than 50, most of the common cause of knee pain is osteoarthritis. In India, 2021 census, there are about 7 crore population with osteoarthritis of the knee who need some form of treatment. There are 2 crore people waiting for knee replacement at any given time. So it's a very common problem. And nowadays, osteoarthritis, nobody should suffer with the knee pain, because we have various levels of treatment. Yes. Stage 1 to stage 4. Knee replacement is like cataract operation nowadays. And we do fast track knee replacement surgery, yes, which is a way of discharge them 24 hours. So people should not be suffering with a knee pain. And if they have severe arthritis, they should see their doctor for appropriate treatment.
Absolutely. When should I ice an injury and when should I heat an injury?
Yes, that's also a good question. Most of the injuries, ice is good, because what happens following injury, there's more blood supply, swelling, and icing is very important. But the way you icing is also important. You should not apply ice directly over the skin. Put a towel. Over a towel, you should put ice, and it should not be more than 10 minutes at a time. Otherwise, you get ice burns. You can apply about 3 times in a day. What happens is the chronic injury, heat can be applied, but acute injury, heat should not be applied, because it will make it worse.
How can I prevent fractures? We also said this earlier, but how frequently should I have a bone density test?
Yes, that's important. You must have, because that's the only tool we have. You should have bone density minimum once in a year. And if you suspect any fracture, I think you should have further investigations. The best way of prevention is taking proper diet, proper health checkups, regular health checkups, because the Apollo, we are very lucky, and everyone should utilize the Pro Health, which is available to everybody, which will diagnose most of these conditions indirectly. So it's better to have a preventive medicine, cheaper, economical, and we can avoid most of the complications, especially for osteoporosis, because once you get vertebral fracture, we can't reverse it. We can only prevent further fractures. Once you have a fracture, we have to replace it in elderly. We can't get back to your natural hip. So it's very, very important to have a regular health checkups to know whether you are suffering from osteoporosis.
The last question is this: I have pain in my upper limb, and sometimes both the left and right, but sometimes I feel okay. What are your suggestions, please?
I think that's a little non-specific. There could be many reasons. Most of the time, if it is young people, it could be related to the shoulder or elbow, most of the time tennis elbow. If it is little older people, common cause in upper limb pain is cervical spondylosis. And it's very common in IT people without cervical spondylosis because of their bad posture. They're constantly sitting on the computer, or those who watch TV constantly in a bad posture. And what happens is the nerves get trapped in the neck and pain radiates to the upper limb. So you must get checked and see what is the cause for the pain, and that can be rectified.
So I think that's about it. So thank you so much, Dr. Reddy, for taking time and patiently answering not only my questions, but also many from our viewers. Viewers, I do hope that you had an illuminating discussion, and please start following all the tips and advice given by the doctor to ensure that you always are at the peak of your bone health, because healthy bones ensure that you're always fit and energetic to pursue all your goals. And do reach out to us for any further queries or assistance or support. We are present on all the social media channels to respond to any assistance or consultative support that you need. We always say that for women, in fact, one of the most powerful quotes by Ayn Rand for women was, the question isn't who's going to let me, it's about who's going to stop me. But remember that there is one thing that can stop us from realizing our aspirations and dreams, and that is poor health. So start today, take the annual check, live a healthy life, and feel good and conquer the world. Thank you and namaste.
Namaste. Thank you very much for your patient listening.
Thank you.